Part 2, Disorders and Treatments to Know. Chapter 1, People are not their symptoms, using person-first language. Before discussing different diagnoses and disorders, it is important to recognize the power of language in shaping perceptions of individuals with behavioral, developmental, and intellectual disorders. No one is autistic, schizophrenic, or manic. These are conditions people experience, not identities. Using a disorder or diagnosis as a label diminishes a person's individuality. The individuals you serve have dreams, goals, strengths, likes, and dislikes, just like you. A way to respect an individual's uniqueness is to use person-first language. This approach prioritizes the person before their condition, emphasizing that individuals are more than their diagnoses. By placing the noun before the adjective that describes it, we reinforce their identity beyond the disorder. For example, rather than saying mentally ill child, say a child with mental illness. Practice using person-first language when discussing individuals with your supervisor, mentor, and colleagues. Additionally, encourage families to use person-first language when describing their loved ones receiving treatment. Changing how families talk about their relatives can positively impact their perceptions and interactions. Chapter 2, Behavioral Health Disorders. As a case manager, you will work with a diverse population of individuals with varying disorders. Understanding these conditions will help you better comprehend why someone may behave in a certain way. Behavioral health, sometimes called mental health, encompasses a person's thoughts, emotions, actions, and behaviors. This manual provides an overview of the most common diagnoses you will encounter. These classifications come from the Diagnostic and Statistical Manual of Mental Disorders, DSM, published by the American Psychiatric Association, which is the standard reference for diagnosing behavioral and mental disorders. While disorders are often discussed separately, individuals can have multiple diagnoses. For example, a person may have ADHD while also experiencing a specific phobia or anxiety disorder. The term comorbid is used to describe individuals with two or more disorders. Attention deficit/hyperactivity disorder, ADHD. As a child and adolescent case manager, you will frequently encounter children diagnosed with ADHD. This condition affects multiple aspects of a child's life, including interactions with parents and peers and performance in school. ADHD is categorized into two primary dimensions: inattention and hyperactivity impulsivity. Symptoms of inattention: forgetfulness, high distractibility, difficulty organizing tasks, frequently losing or misplacing items, difficulty following directions, appearing not to listen when spoken to directly. Symptoms of hyperactivity impulsivity: fidgeting or squirming, difficulty remaining seated, running or climbing excessively in inappropriate situations, difficulty playing quietly, acting as if driven by a motor, talking excessively, blurting out answers, difficulty waiting their turn, interrupting or intruding on others. Children may display symptoms from one or both dimensions. As a result, mental health professionals classify ADHD into three types: combined, predominantly inattentive, and predominantly hyperactive impulsive. Oppositional defiant disorder, ODD, and conduct disorder, CD. ODD and CD impact a child's relationships with parents, school, and society. These disorders differ primarily in the severity of inappropriate behaviors. Oppositional defiant disorder, ODD, characterized by a pattern of negative, hostile, and defiant behavior. Symptoms may include frequent temper loss, arguing with authority figures, refusing to comply with rules, deliberately annoying others, blaming others for mistakes, acting angry, resentful, spiteful, or vindictive. Developmental appropriateness must be considered when assessing defiant behavior. For example, while it is typical for a 2-year-old to resist rules, an 8-year-old should be able to follow them. Conduct disorder, CD, a more severe behavioral disorder characterized by violations of societal norms and the rights of others. Symptoms may include frequent bullying or threatening behaviors, initiating physical fights, using weapons that cause harm, cruelty toward animals or people, deliberate destruction of property, theft or deceitfulness, serious rule violations such as truancy or running away from home. Mood disorders. Mood disorders affect an individual's emotional state, ranging from extreme lows, depression, to extreme highs, mania or hypomania. The most common mood disorders you will encounter as a case manager include major depression and bipolar disorder. Primary symptoms: depression, persistent sadness, frequent crying, extreme irritability, sleep disturbances, insomnia or excessive sleepiness, feelings of worthlessness or guilt, loss of interest in previously enjoyed activities, recurrent thoughts of death or suicide, mania, inflated self-esteem or grandiosity, excess energy, decreased need for sleep, excessive talking or pressured speech, racing thoughts, impulsive, high-risk behaviors, e.g., spending sprees, reckless driving, impulsive sexual encounters. Depression is a serious condition that differs from occasional sadness. If a child or adolescent experiences persistent sadness that disrupts daily functioning, it may indicate major depression. Some children may not recognize their feelings of sadness and instead exhibit irritability, disruptive behavior, or complaints of physical pain, e.g., headaches, stomachaches. Adolescents with depression may be at increased risk for suicide, necessitating careful assessment and intervention, which will be discussed in Part 5, Chapter 2. Mania in children is uncommon but increases with age. Symptoms of mania in younger children may include explosive irritability, tantrums, and rapid speech, while older children and adolescents may exhibit more typical manic symptoms such as decreased need for sleep and risky behaviors. Bipolar disorder and ADHD share some overlapping symptoms, such as hyperactivity and impulsivity. However, key differences exist. Bipolar disorder occurs in episodes, whereas ADHD symptoms are chronic and persistent. Mood shifts in bipolar disorder occur independently of external events, while emotional responses in ADHD are typically triggered by external situations. ADHD symptoms often improve with stimulant medication, whereas bipolar disorder requires different forms of treatment. Anxiety disorders. Anxiety disorders are increasingly diagnosed in children and adolescents. While different types of anxiety disorders exist, they all involve intense and persistent worry or fear. Generalized anxiety disorder, GAD, characterized by excessive, widespread worry not limited to a single concern. Children with GAD may excessively worry about school, friendships, health, or other everyday matters.